Hello everyone and welcome to Forensic Extract, and please do subscribe Forensic Extract for various videos related to forensic medicine and toxicology and Indian medical legal system. So today we will be discussing about lead poisoning. Lead poisoning. So the fictional character Dracula, as shown in the picture, is supposed to be suffering from lead poisoning because in various movies it is shown with facial pallor and bilateral wrist drops. So probably the explanation was given that he was living in some caskets and those caskets were lined with lead paint. So that's why he was suffering from lead poisoning. So this is all about Dracula. And then lead. So lead is a silvery gray. It is a silvery gray soft metal. Lead is a silvery gray soft metal. And the uses of lead, as we all know that lead is used in construction of buildings. So buildings construction, then in various billets and shots, and in ceramic industries as various in various hair dyes, and in shoulder and shot making. So these are the uses of lead. Now the various toxic salts of lead. So toxic salts of lead. So the common toxic salts of lead are, first is lead acetate. Lead acetate. Lead acetate is sweet in taste, so that's why it is also known as sugar of lead. It is also known as sugar of lead. And lead carbonate. Lead carbonate. Lead carbonate is also known as safeda. Safeda. Then lead tetroxide. Lead tetroxide. Lead tetroxide. It is the red lead or sindoor, sindoor or vermilion. So this is lead tetroxide. Then finally we are having tetraethyl lead. Tetraethyl lead earlier was used with petrol because it is an anti-knocking agent. It inhibits or suppresses the knocking of engine motor vehicles, but it is poisonous, so that's why it is discontinued. So these are the toxic salts of lead. Now the toxokinetics. So toxokinetics of lead is toxokinetics. So in toxokinetics, we are having absorption, then distribution, and finally excretion. So lead is absorbed from oral cavity. So it is absorbed from oral cavity, but the absorption is less efficient. It is not that much efficient from oral cavity, and cutaneous absorption. Absorption through skin is cutaneous absorption is very poor. So cutaneous absorption is very poor, and lead crosses placenta. Crosses placenta. So this is the something about absorption of lead. Now the distribution. So lead is mostly distributed in bone. It is distributed in the bone in insoluble form as lead phosphate and lead carbonate. So these are the insoluble forms of lead in bones. Now remaining lead accumulates in soft tissues, and this concentration of lead in soft tissues is responsible for toxicity of lead. So this is the distribution of lead. Then finally excretion. So lead is excreted from kidneys in urine and bile, and the primary excretion is through kidney in the urine. So this is the toxokinetics of lead. Now the mechanism of action. So mechanism of action is the primary mechanism is the inhibition of various enzymes of heme synthesis. Heme synthesis. So lead inhibits various enzymes of heme synthesis, like the this is the cycle which is showing synthesis of heme. So we are having succinylcholine and glycine, and this is the enzyme LR synthase, which forms alpha delta amino levulinic acid. So this is the levulinic acid which converts in porphobilinogen by LR dehydratase. And finally, there is formation of heme by conversion of protoporphyrin 9 into heme by the enzyme ferrochelatase. So these are the two enzymes. One is LR dehydratase and second is ferrochelatase. These two enzymes are inhibited by lead. So what happens after inhibition of LR dehydratase? There is increased concentration of delta aminolevulinic acid. So increased concentration of LR and increased concentration of protoporphyrin 9 after inhibition of ferrochelatase. So these two laboratory investigations are very important for diagnosis of lead poisoning. Now this is the main mechanism. Now some other mechanisms are also there. These are the inhibition of sulfhydryl groups. Lead inhibits sulfhydryl groups in various enzymes, and lead mimics calcium. It mimics calcium, so it accumulates in various tissues and bones. So it inhibits various metabolic pathways. Various metabolic pathways. Lead also responsible for promoting apoptosis. So these are the mechanisms of lead poisoning. Now something about the fatal period and fatal dose. So grossly, the fatal period of lead poisoning is 1 to 2 days, and fatal dose of lead acetate is 20 gram approximately, and of lead carbonate is 40 gram approximately. So these are the fatal dose of lead acetate and lead carbonate. Now the important topic in the lead poisoning that is very important for MCQ purpose as well as for long question and short note, that is the chronic lead poisoning. Chronic lead poisoning. So chronic lead poisoning is also known as colica pictonium, or the colic pain in lead is also known as Devens colic, or it is also known as Miner's disease. It is also known as plumbism, because the lead is also known as plumbum. Lead is also known as plumbum in Latin. That's why it is known as plumbism or Saturnism. So these are the other names of chronic lead poisoning. Now, what are the common sources of lead poisoning? So, first is the drinking water. Drinking water. Water is flowing through lead pipe or lead pipes, maybe there at the junction. So that's why there is lead poisoning, chances of lead poisoning due to drinking water. Then second is the storage cisterns. Usually, people store ghee in various cisterns made up of lead. So that's why there is formation of lead oleate, and that is toxic. Now, lead is also present in hair dyes, and cosmetics. So chances of exposure is there. Now, lead is present in various lead paints. So occupational exposure is also there in painters, plumbers, printers, etc. And what happens if some retained lead ammunition in the body, retained lead ammunition like souvenir bullet, that is also responsible for lead poisoning. So these are the sources of lead poisoning. Now, signs and symptoms of chronic lead poisoning. So, sign and symptoms. So, first sign is the facial pallor. Facial pallor. This is the uh, earliest. It is the earliest and most consistent, most consistent sign. So, facial pallor is the earliest and most consistent sign of lead poisoning. Facial pallor. What is the reason of facial pallor? First is the anemia. It is due to anemia, and secondly due to vascular spasm, vasospasm. So these two are the reasons for facial pallor. Now the second sign and symptom is the anemia. Anemia. Because of inhibition of heme synthesis, there is polycythemia. Polycythemia. Anisocytosis. Poikilocytosis, and punctate basophilia. What happens? These are dark blue, dark blue, pinhead size, pinhead size dots are present in RBC, cytoplasm of RBC, and this is known as punctate basophilia. That is shown in the picture. These are the various dots in the cytoplasm of RBC, pinhead size, dark blue colored dots in the cytoplasm of RBC. So this is punctate basophilia, that is characteristic feature of uh, lead poisoning. Now the lead lines. Lead lines are also known as Burtonian lines. So what are Burtonian lines? These are steepled. Burtonian lines are These are stippled blue lines. So these are the lines which are known as Burtonian lines. These are stippled blue lines, usually seen in 50 to 70% cases. 50 to 70% cases, and seen on the gum. These are the lines which are present on gums. Usually they are associated with poor oral hygiene. Poor oral hygiene. What happens in case of poor oral hygiene? The food particles sticking to the gum and teeth. This food particle after decomposition releases uh, H2S gas. This H2S gas combines with lead and forms lead sulfide, and this is black in color. So this lead sulfide is black in color. So these are the line which are responsible for this lead poisoning, and the main reason of this Bertollian lines are the poor oral hygiene, and it is due to formation of lead sulfate, and these are the bluish black lines. So these are Bertollian lines which are associated with lead poisoning. Now the other sign and symptoms are the colica pictonum, or it is the other name for chronic lead poisoning. So colic and constipation. There may be colic, there may be diarrhea, and there may be constipation. These colics, specific colics in lead poisoning are known as Devens or Painter's colic. So Devens colic or the Painter's colics are the name of colic pain in case of lead poisoning. Now the lead palsy. So lead palsy is usually seen in less than 10% cases. There is hyperesthesia. There may be tremors, and as extensors are more prone to fatigue, so that's why there is a wrist drop, and involvement of anterior nerve causes foot drop. So these are the features which are seen in lead poisoning. Disc drop and foot drop are the feature of lead poisoning. Now lead encephalopathy. So lead encephalopathy. So this is usually seen in children's, and it is irreversible. Lead encephalopathy is irreversible form of lead poisoning. Now various cardiorenal manifestations. As we have just discussed that lead causes vasospasm. So that's why there is hypertension and nephritis, kidney damage. It causes cardiac as well as renal damage and hypertension and nephritis. One of the specific feature of lead is that it inhibits or decreases excretion of uric acid. So that's why there is hyperuricemia, and that uric acid increase concentration. That's why it deposits in the joints, and that is responsible for gout. And this gout is known as Saturnine gout. Saturnine gout. Now, lead also affects reproductive system. Reproductive system, because lead causes sterility sometimes, and menstrual irregularities like amenorrhea, menorrhagia, and dysmenorrhea. These are the features of lead poisoning. Now, sometimes lead is responsible for abortion and premature labor also. So these are the reproductive uh, signs and symptoms which are seen due to involvement of reproductive system. Now, lead is also deposits in the retinal structures. So that's why in the retinoscopy you'll see fine deposition of lead particles, glistening grayish lead particles. Glistening grayish lead particles are deposited in the retina. So this is the eye sign of lead poisoning. So far we have discussed various signs and symptoms of lead poisoning. So most consistent and the earliest sign is facial pallor. And other signs and symptoms are there may be basophilic stippling, Bertonian lines, colic and constipation, and involvement of reproductive and as well as the cardio and renal system, and wrist drop and foot drop, and encephalopathy may be seen. Now, how to diagnose lead poisoning? So, based on the history and clinical features, we can diagnose lead poisoning. And blood picture is also very significant. It shows anemia, and raised erythropoietic protoporphyrin is also. Punctate basophilia is also a characteristic feature. Then sometimes we can go for radiology also, radiographic investigation, which shows dark transverse band, dark transverse band due to deposition of lead underneath the metaphysis. So underneath the metaphysis, there is dark transverse bands in the bones, long bones are seen on the radiological investigations. And sometimes we can go for X-ray fluorescence. X-ray fluorescence. So it is important in diagnosing or the estimating lead concentration, lead, bone lead concentration. X-ray fluorescence is efficient in estimating bone lead concentration. So this is about uh, laboratory diagnosis of lead. Now the management of lead poisoning. So how do we manage lead poisoning? First and foremost thing is reduction of source. Source reduction is the first and foremost thing. Then various chelating agents are there. Chelating agents. So two important chelating agents for lead poisoning are bitis and calcium disodium EDTA. These are two chelating agents which are useful in lead poisoning. But what happens if the person or the patient is suffering from encephalopathy? Encephalopathy. This bitis is having small granules and small particles, so they can enter in the brain as compared to calcium disodium EDTA. So first we'll give bitis in case of if a person is having encephalopathy. Because if we will give calcium disodium EDTA initially, then it will decrease the blood as well as urine concentration, but it increase the brain concentration, and thus it can worse the encephalopathy. NCAF. So always go for British and Levside before the calcium disodium EDTA. Now we can also add folic acid, pyridoxine with these chelatic agents. So British anti-Lewisite is excretes through bile, So in case of renal damage or nephritis, we'll give beta-centralevicide. We will not try calcium disodium EDTA in these cases uh, of renal failure. Now the postmortem appearance. Postmortem appearance. So first is the Burtonian lines. Obviously, Burtonian lines will be there. Burtonian lines will be seen. Now the facial pallor, wrist drop, foot drops are also may be seen, but the visceral findings are important. That is, the brain will be pale and swollen, and heart will be hypertrophied. Heart will be hypertrophied. Then there may be mucosal hemorrhage. Mucosa will be markedly congested and hemorrhagic mucosa. And kidneys and livers and other visceral organs are contracted. Obviously, bone marrow will be hypercellular, and filled with premature red cells, red blood cells. Now, the medical legal importance of lead poisoning. So, one of the compound of lead that is known as lead oleate, that is known as lead oleate or diacylon. Diacylon. This is the compound which is used for criminal abortion. Criminal abortion. So, lead is also used for criminal abortion. Now, lead poisoning is common in various drug abusers because of use of lead in adulteration of cocaine and cannabis. So that's why a person consuming cocaine and cannabis are susceptible or are chances of lead poisoning are there in these persons. So it is common in drug abusers also. Now sometimes what happens uh, about souvenir bullet. So souvenir bullet is the impacted bullet in the bone or vertebral column that slowly releases lead, and that is also responsible for lead poisoning. Sometimes lead poisoning can be seen in chronic cases after prolonged application of lead on forehead or scalp by female. So that's why the lead poisoning is commonly seen in various occupations also occupations. So that's why the employer's liability to pay compensation for a person who has suffered from lead poisoning while working in certain industries. So the employer is liable to pay compensation in these cases. So this is the all about lead poisoning. So please do subscribe Forensic Extract and keep on watching. And thanks a lot. Thank you guys.